From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice. Here's your host.
Hello, and welcome to this JAMA Clinical Reviews podcast. I'm Dr. Kirsten Bibbins-Domingo, and I'm the editor-in-chief of JAMA and the JAMA Network. I'm joined today by Dr. Isa Davis, a practicing family physician and health services researcher. Dr. Davis is professor of family medicine, the Associate Vice President of Community Health, and the Senior Associate Dean of Population Health and Community Medicine at the University of Maryland School of Medicine. She is the lead health equity strategist for the University of Maryland Institute for Health Computing. Dr. Davis is also the director of the Transforming Biomedical Research and Academic Faculty through Opportunity, Training, and Mentorship Program, also known as Transform. Dr. Davis is a member of the U.S. Preventive Services Task Force, and she's joining us here today to discuss the new recommendation statement from the task force on screening and supplementation for iron deficiency and iron deficiency anemia during pregnancy. JAMA has published this recommendation statement and the evidence report on which the task force recommendation is based. Dr. Davis, thanks for joining me here today.
Thank you for having me, Dr. Domingo.
Wonderful, wonderful. And hopefully we'll go by Isa and Kirsten for this talk, if you don't mind.
Yes, ma'am.
I usually start by asking you to provide a high-level summary of the recommendation statements. We have two: the evidence for screening, that is looking for iron deficiency in somebody who's pregnant and otherwise asymptomatic without a history or symptoms, and then routine supplementation. What did the task force find?
Yes, thank you. So first, just to say that iron is important for overall health, especially during pregnancy. And what we basically found is when we're talking about screening for iron deficiency or iron deficiency anemia in pregnancy, we did not find that there was enough research to make a recommendation for or against screening in this population in terms of overall health for mom and baby. We likewise found that routine supplementation of iron during pregnancy, also, there was not enough evidence to make a recommendation for or against using iron or supplementing iron during pregnancy to improve mom and baby's health. And that basically more research is needed for both of those things.
So these are I recommendations and I statements, insufficient evidence. As you said, there's not enough evidence for or against. And really, this is a call for the task force to tell the research community that more high quality evidence is really needed in this area.
That's correct. More randomized controlled trials, more observational studies that basically show us that screening for iron deficiency or iron deficiency anemia does improve overall health outcomes for both mom and baby. And also likewise, that when you supplement with iron, that you see a change in those hematologic markers that then show that there is improvement, again, in the overall health of mom and baby.
So you started by saying that iron is important. So give us an idea of why iron is important during pregnancy, and do we see deficiency, and what are the consequences, and who might be deficient?
Yes, so iron is important in the body to help carry around the oxygen to all the different tissues. And what happens in pregnancy is that your demand for iron goes up as a part of pregnancy. And so we see that group tends to have a higher prevalence of iron deficiency or low iron stores or iron deficiency anemia. And that's when your stores get low and your hemoglobin as a marker of anemia is also low. And so pregnant persons are at greater risk for this happening. Again, what we found when we looked at the evidence is that doing this, there isn't enough evidence to show that it makes a difference in terms of the outcomes for both screening or for supplementation.
So where are the gaps in the evidence? So it sounds like you were able to review some studies, but are the studies just missing that show that when you either screen or you routinely supplement, that you change something for the health of the mother or the baby? Where's the gap?
Right. So that is where some of the gaps are, is that when you, for instance, screen and detect the deficiency, then when you supplement, where those markers change are linked to improvements in outcomes. So For instance, we use ferritin as a marker for iron deficiency. And so we need studies that show, first of all, there's no consensus on what level of ferritin actually marks iron deficiency. But then the change in ferritin when you supplement is then related to a change in those outcomes, right? So we need evidence to show that when you screen, that screening, when you supplement, that those markers actually change, and that those change in that markers, that change in that hemoglobin is then linked to improvements in some of those outcomes for the pregnant person and also for the baby. That's what we're really missing.
That gap that's going not just to changing the value on a blood test, but actually changing health outcomes that we are concerned about in mother or baby.
That's correct. That's correct.
Are these only trials that we're looking for, or can observational studies help? How do you evaluate the overall quality of the literature?
We certainly put emphasis on the randomized controlled trial, but we also call for observational studies that are also very important, well done, rigorous observational studies that, again, can also show that link between those change in hematologic indices and that improvement in outcome. So those studies would also be really important to do.
One of the roles of the task force is really to signal to the research community when there's more research needed in a particular area. But in the meantime, clinicians are caring for patients. And as you said, iron is important in general, and particularly during pregnancy when the demands are higher. So how do you think about what clinicians should do in the meantime and what you might do in your practice? You're a family physician.
We certainly want pregnant people to get the care that they need. And so we always recommend that if they have any concerns, if they have, of course, signs or symptoms, that they should have conversations with their clinicians. And clinicians should then manage using their best clinical judgment. Iron gets checked for a variety of different reasons. And so clinicians should use their judgment to care the best for their patients, as they always do.
So give us the final take home then.
Iron is really important for overall health, especially during pregnancy, but this is really a call for more research that we're looking for trials and studies that show that screening for iron deficiency and iron deficiency anemia, as well as routine supplementation, improves the overall health of the pregnant person and their baby. But in the interim, we do always want patients to seek the care from their physicians, have the conversations, and that they do care for them in the best way that they know how.
Wonderful. Is there something else you'd like to make sure that we understand about this recommendation?
In this call for more research, also want to make sure that we remember that there are certain populations that are at more risk of developing iron deficiency, iron deficiency anemia, and certainly would call for more research to look at those special populations so that we can also improve the disparities that we see in this condition as well.
And which are those pregnant people who might be more at risk?
Yeah, so our pregnant people in the Black population and our Mexican American population tend to have higher prevalence of iron deficiency and iron deficiency anemia, and certainly for those populations that suffer from food insecurity. So special calls for research in those populations would be important.
Well, thank you, Isa. I've really enjoyed speaking with you today about this important recommendation and the call for research that needs to occur in this area. I've been speaking with Dr. Isa Davis, a physician and member of the U.S. Preventive Services Task Force, about the new task force recommendation on screening and supplementation for iron deficiency and iron deficiency anemia in pregnancy. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.